Hello there, everyone. Welcome back. We are in our latest episode of Ask Dr. Bob. And as you know, this is where you get to throw out questions to me. I'm Bob Gabbay. I'm the Chief Scientific and Medical Officer of the American Diabetes Association, and I'll do my best to answer your questions. I hope you've all been well and staying healthy, and let's get started. So there were a lot of questions that are focused on what is on a lot of our minds these days, and that is COVID and the COVID vaccine. So I'm going to run through a whole series of these that clearly is on everybody's mind and very important. So let's start at the very beginning and saying, why is it recommended to get the COVID-19 vaccine for people with diabetes? Well, that is a really important question. Let's start with the fact that people with diabetes are at increased risk of having more severe complications from COVID. And that's really why we want to prevent people from getting COVID infection so they don't get those bad complications. What am I talking about? Well, here's a scary statistic in some ways. If you look at all the people that have died in the US from COVID, 40% of them have diabetes. So diabetes is a really big risk factor for bad outcomes, for being hospitalized and potentially dying from COVID. And therefore, it's really important to get vaccinated. Um, one of the questions that comes up is, what are the side effects of the vaccine? Well, the side effects are largely the same side effects from the flu vaccine or other vaccines you may have gotten. Your arm may be a little bit sore. Some people may have mild flu-like symptoms that may last a day or two. But those are really the common side effects or the possible side effects. And again, those don't represent the fact that you have COVID. No. It's just the body's immune system reacting to the vaccine. And so people may feel a little under the weather for a day or two at most. There are a few very rare cases of allergic reactions. And let me say, very rare. We're talking out of 2 million people, a handful of people that have gotten those reactions. So that's why they ask you after you get vaccinated to stick around for 15 minutes so they can make sure you're not having any serious reactions, which again are very, very rare. Um, really happen early on, right after the vaccine, for a very few number of people. And again, when you're thinking about, should I get the vaccine or not? Well, there's the risk of getting COVID and having a bad outcome. And for people with diabetes, that's, unfortunately relatively high versus these extremely rare complication risk. And again, extremely rare. So again, a safe vaccine that we very much recommend. So much more so that, and there's a question here about people with type 1 diabetes. One of the things that we at the American Diabetes Association have been taking the lead on is to advocate that people with type 1 diabetes have the risk of bad outcomes with COVID as high as people with type 2 diabetes. And therefore, they should be prioritized the same way as people with type 2. All people with diabetes should be prioritized as high-risk individuals for the vaccine. So let me move to the next questions. Should I talk to my doctor before getting the COVID-19 vaccine? I'm never one to say you shouldn't talk to your doctor. I think that's fine. But this is one where you don't want to delay the opportunity to get the vaccine. And so unless you have a history of really dangerous allergic reaction, anaphylaxis. Anaphylaxis is an allergic reaction that people get short of breath, their blood pressure drops, they end up in an emergency room. If you've had that kind of reaction to something, yes, then maybe you should talk to your doctor. Otherwise, your doctor will recommend that you get the vaccine. You're always welcome to speak to them, but it's not necessary that you speak to your doctor before you get the vaccine. Okay. So here's another question. They're asking about should my daughter, age 11, who has type 1 diabetes, get the vaccine? Or is it more encouraged for adults with diabetes to take? Well, that's a really good question. And to be honest, we're not 100% sure of the answer on this one. And that is a place where you should talk to your doctor. The vaccine were tested on adults, either over age 16 or over 18. And so we're not sure about the use in individuals that are younger than that. That does not mean that your doctor may still recommend it, but that is a good place to talk to your doctor about vaccinating children. Adults, essentially a no-brainer. So here is another question. Again, our theme here is vaccination for COVID. My father has type 2 diabetes and is seeing a list of scary videos online, of which, there are many, of people getting seizures due to the vaccine. He refused to take it. What can I do? Well, like anything on the internet, as we all have come to realize, literally anybody can post anything on the internet, and there's no fact checking that happens. I would go and I would encourage anybody to really go to the reputable sources for medical and scientific information. The American Diabetes Association has a wealth of information on COVID, on the COVID vaccine. And one thing that we'll post in the chat is information where, depending on what state you're in, information on that to know where you can go and find out more information about getting the vaccine in your state. So I would advise your father to take a look at the standard medical factual sites like the American Diabetes Association. And I would also say that getting seizures due to the vaccine has not really been a problem. That is, there are so many more people dying of COVID than the tiny, tiny number of people that have had some reactions to the vaccine. So again, you're weighing one against the other. Honestly, no brainer. Okay, let's move along. How long does it take for the vaccine to take full effect? That's a really good question. So, as you know, both vaccines that are approved now by the FDA, the one from Pfizer and the one from Moderna, both of them require 2 shots, right? So you need two vaccinations. And the studies to look at how effective they are in preventing people from getting the disease are really based on after that second vaccine. So the benefit is really after the second vaccine, and that's where it's been really sort of measured. And again, like any vaccine, it's not 100%. We've heard, you've probably heard in the news media that the effectiveness is about 95%. So there's still a 5% chance you could be infected by COVID, but a 95% lower risk than you would have. And so you still got to be careful. That's the important thing. And that's one of the questions that the next question that comes up, and someone asks, should I still quarantine, physically distance, and wear a mask when I get vaccinated? Oh, I'm so glad you asked that question, because that is a super important one. And the answer is absolutely. Absolutely, for a variety of reasons. What was studied about the vaccine was whether it would prevent people from getting COVID. and getting infected. What has not been studied yet is, does it prevent you from spreading COVID? So could you not get sick from COVID, but carry it and be able to spread it? And until we know better, yes, you should take all of the right precautions that we advise everyone to do, to physically distance, wash their hands, wear a mask, until we know better, even if you are vaccinated. So let me make sure we're all clear on that one. We're not out of the woods yet. It is the light at the end of the tunnel, but we are not out of the tunnel yet. Okay, next question. What can I do if I feel sick after getting the vaccine? Well, again, what I said, the most common side effects are your arm being a bit sore, and having a little feeling of being under the weather, maybe some body aches for a day or two. For those kinds of symptoms, you can take and again, this is something to discuss with your healthcare provider, but the common things that one would take if they had those kind of symptoms, flu-like symptoms, could be something like acetaminophen, Tylenol, or ibuprofen, Motrin, Advil, those kinds of medicines. If you've taken them in the past and your provider has recommended them in the past, those are reasonable things to think about taking. The more serious complications, of which are extremely rare, I can't say that often enough, extremely rare, those appear right after the vaccine. And so that's not something you're going to notice the next day or 2 days later. So not something you need to worry about. So here's a question in terms of type 1 and type 2 diabetes. And I mentioned that the American Diabetes Association is advocating very strongly. We led an effort and reached out to the Center for Disease Control, where we got many other organizations from around the country to join in an effort that we led to the CDC to say people with type 1 diabetes need to be prioritized in the same way as people with type 2, because their risk is largely equal to what people with type 2 have in terms of infection. So type 1 and type 2 people with type 1 and type 2 diabetes should get the vaccine. And the question here is, does the vaccine work any different in people with type 1 or type 2 diabetes? And we have no reason to believe that it works any differently. They didn't study that in particular, so we're not sure, but there's no reason to think that it would work any differently. I will say that the vaccine trials included many people with diabetes. Most of them were with type 2 diabetes, but it included many people with diabetes. And again, the evidence suggested it was effective for that group of individuals. So just to clear that up. We're getting some more questions here. Well, and this is one that we sort of talked about already, and that is, if you get the vaccine, can you still contract and spread the virus? And contract, yes, but there's a 95% chance that you won't contract it, but there still is a small chance that you could. And because of that, you could spread it. And that's why, for better or worse, once you get vaccinated, we still need to do the right things. And that's wearing a mask, washing our hands, and staying physically distanced from each other. Let me also say one thing that is important for us to keep in mind. I purposefully use the word physically distance and not socially distance. We want to be connected with each other socially. Online is obviously a great way to do that. Calling people on the phone, being in contact with people is really key, because you don't want to feel isolated. It's tough enough for all of us dealing with this change in the world. And so it's important to be socially connected, but physically distant. So that's why I use that word physically distant. We have another question here. Um, why should I take the vaccine and still quarantine and wear a mask? Yes, that's exactly the kind of question we're talking about here. And this is such an important issue. So let me suggest, where some of these questions are coming from is, so when do we ever move on? Like, are we going to be physically distancing ourselves forever? Well, there is this concept, and you may have heard of, you may have seen this term called herd immunity. And the idea is, when enough people are vaccinated, and we think that number is around 2/3 or 70% of people are either vaccinated or immune to COVID because they already had it, that's when the disease will largely die out and not spread. Because even if one person gets it, they won't be able to spread it to the next person because the next person is likely to already be vaccinated. So that's really when we'll be in a new position where we can start relaxing some of the restrictions that we've all had to live with for the benefit of literally saving lives. That's bottom line. That's what we're doing here. It's about saving lives. So let me check another question here that we just got here. Uh, this is an interesting one. I'm going to have to. So, what do I do if my doctor isn't recommending the vaccine? That is a tough one. So, the only groups of people that the CDC are recommending to consider not taking the vaccine, or there are very few groups. Uh, People that have had that anaphylactic reaction. In other words, they've had such a serious allergic reaction that they got short of breath, had to go to the emergency room and get an injection of epinephrine. That's different from a rash or any other kind of allergy. Those people, yeah, they may not be the right people to get the vaccine, and that's absolutely, you should follow your doctor's recommendations. Um, Children, another group that is not well studied. So like anything, when one's provider provides information that seems very different than what's out there from reputable sources. Remember that, so American Diabetes Association, our website, for example. Um, then I think it's worth asking why. Can you explain more and engage them in a conversation? But the vast majority of people um, are eligible and should get the vaccine. But there are some rare exceptions, and your doctor may be aware that you are one of those rare exceptions, but of course, you have the right to know why. So here we are. Uh, well, it looks like, yeah, we've flown by once again another episode of Ask Dr. Bob. So thank you all for joining and taking time out of your busy day. I hope that you all stay well. I hope this has been helpful. And join us for our next episode of Ask Dr. Bob, and stay smiling and be safe. Bye, everyone.